Hello class, my name is Angel Emerson and I'm proposing a research project that investigates a critical and timely question. Does the use of AI-powered diagnostic tools in primary care settings impact patient trust and satisfaction with their physicians and ultimately their willingness to follow treatment plans? My research question, does AI in healthcare help or hurt trust? And does AI-powered diagnostic tools in primary care affect factors for positive and negative impacts with patient trust, patient satisfaction, and treatment adherence is as so. With patient trust, positive impacts can be better accuracy and perceived objectivity. With negative impacts, it can be lack of transparency in interpersonal care. With patient satisfaction, faster personalized care is the positive impacts, with negative impacts being tech over human touch, perceived AI dominance. In treatment adherence, a positive impact would be tailored reminders, improved understanding, and a negative impact would be a lack of trust and reduced permissive and encouragement. AI is changing how doctors diagnose and treat patients. But how do patients feel about AI in the exam room? Trust and satisfaction influence whether people follow medical advice. Artificial intelligence is rapidly transforming healthcare, especially in diagnostics. AI tools can help doctors make faster, more accurate decisions. But here's the issues. We don't yet know how patients react to these tools. Do they feel more confident in the care they receive or less? Do they trust their doctors more or start to question them? And does this affect whether they follow through on their care that's recommended? These questions matter because that even the most accurate diagnosis is useless if the patient doesn't trust it and will not follow it. As AI becomes more common in clinics, understanding the human side of technology is inevitable. This is a casual study. One main question is, does introducing AI diagnostics tools in a primary care visit affect patient trust, satisfaction, and adherence to treatment? The independent variable, whether or not an AI-powered diagnostic tool is used during the patient visit, and the dependent variables is patient trust in their physicians, patient satisfaction with their visits, patient adherence to treatment recommendations. I will measure these variables. Independent variables will use of AI diagnostic tools, and dependent variables trust in physicians, patient satisfaction, and treatment adherence. We'll work with a sample of primary care clinics and divide vitals into two groups. One group where doctors use AI support in front of patients, another where traditional diagnostic methods are used without AI assistance. After the visit, patients will complete a short survey with will use simple, well-validated questionnaires to measure trust, satisfaction, adherence. All terms will be clearly explained to patients to avoid confusion. For this experiment would be randomized controlled trial, with Group A being a AI-supported visit and Group B being traditional visits. Surveys and follow-ups assess patient responses. We'll conduct a randomized controlled trial, the gold standard in research, as you all know, that allows us to isolate the effects of AI by comparing similar patients with one key difference, where the AI was used in their care. AI has the potential to positively impact patient trust, satisfaction, and adherence to treatment plans by enhancing diagnostic accuracy, streamlining communication, and offering personalized recommendations. When physicians explain that AI supports rather than replaces their decisions, it can increase patient confidence in their judgment. AI tools can be improved communication by providing clear visual explanations and driven insights, helping patients better understand their complicated illnesses. However, challenges arise if there is over reliance on AI, transparency is not clear, or failure to explain AI's role can occur, which may lead loss of trust, confusing patients, or hindrance in adhering treatment. Outcomes, we see here that trust is confidence in a physician's decisions, satisfaction, communication, and clarity, and adherence. Did patients follow treatment plans? All of these show very, very important roles and positive impact versus the challenges that they face when met with impact of AI-powered diagnostic tools in primary care. With these soaring 70% to the 30% in trust, is a positive impact on the use of AI. The 65% in satisfaction to the 35% in satisfaction is very good and positive impact for the diagnostic use in AI. And adherence is being even higher at 75% to 25%, showing an even more positive impact that AI use in healthcare can be. Timeline and budget. The timeline for incorporating AI into the medical field could be as efficient and as quickly as 6 months total, 2 months for planning and recruitment, 2 months of clinical base and data collection, and 2 months of analysis and reporting. With an estimated budget of $45,000, $20,000 for participant incentives and survey administrations, $10,000 for software data processing and tools, and $15,000 for personnel, research assistants, data analysis, in between clinics. How can AI help build trust in healthcare? Faster, more accurate diagnosis. AI can analyze scans or data quicker than humans, helping doctors catch issues earlier and more accurately. 24/7 support. AI powered chatbots or virtual nurses can answer questions anytime, helping patients feel more supported and informed. Less human error. When used right, AI can reduce mistakes by double checking prescriptions, test results, or treatment plans. Personalized care. AI can sort through massive amounts of health data to tailor treatment specifically to a person's unique needs. Efficiency equals more face time. By handling paperwork and unnecessary tasks, AI can free up doctors to spend more time facing their patients. How can AI hurt healthcare trust? Lack of transparency. When patients don't trust how an AI made its decision, it can feel cold or confusing. Less human interaction. If AI replaces too many personal touches, patients may feel like they're just another number in a machine. Privacy concerns. AI uses a lot of data, and if that data isn't well protected, it could lead to major trust issues. Bias in data. If AI is trained on bias or incomplete data, it can make an unfair or even dangerous decision, especially for underrepresented groups. Tech doesn't equal empathy. AI might be smart, but it's not compassionate or truly get what's going on in somebody's world emotionally. So using AI may lose a human emotional compassion and touch. Why fund AI? AI in healthcare is growing fast. The research assures and introduces ethically and efficiently. Supports patient-centered tech-informed healthcare policies. Investigating an AI for healthcare holds the promise of improving healthcare, lowering costs, and addressing systematic challenges in the industry, making it a worthwhile allocation of funding. AI has huge potential to improve healthcare, but trust depends on how it's used. When it supports, not replaces, human connection, and when people, not AI, keep informed and involved, it can build trust and keep people from feeling impersonal and confused without creating risk and distance between patients and their caregivers. Thank you. AI in primary care has the potential to enhance trust, satisfaction, and adherence if it's used transparently, ethically, and as a complement to human clinicians. The key is balancing technology with empathy and maintaining strong patient-provider communication. As someone currently working in healthcare as a dental assistant, I strongly support the integration of AI into our systems and daily practices. While there are valid concerns about privacy and the importance of maintaining human connection, the benefits of AI far outweigh the risks when implemented responsibly. AI can assist in diagnosing conditions faster, reducing error, improving patient monitoring, and allowing healthcare professionals to spend more time on what truly matters, connecting with and caring for patients. Rather than replacing human roles, AI should be viewed as a tool to enhance our abilities to provide safer, more efficient, and more personalized care. By embracing innovation while still prioritizing empathy and ethical use, we could build a stronger, more trustworthy healthcare system for everybody. Thank you.